Doctora Emma, Emma Vélez. Yo soy Lady Joana Espinosa Catán. Acudo a usted porque necesito que usted me ayude. Estuve en el E.P.S desde el 29 hasta el día de ayer hospitalizada, esperando una remisión. Me la hicieron anoche y que hoy venía el cirujano y el ginecólogo a verme. A las 3 de la tarde que venía el cirujano y no llegó. Hacen sino hacerme exámenes y no me ponen cuidado. Tengo el estómago muy inflamado, mucho dolor y la verdad, tengo 2 niños a los cuales no quiero dejar solos. Yo le pido, por favor, que me colabore. Muchas gracias.
First of all, it's necessary to understand the origin of medical negligence. So everything government has a role on it. Administrative problems are the most significant factors of the medical negligence. Why? In the Law 100 of 1993, the health system weighted the offer to public and private workers. The offer was weighted, but the demand came bigger. The administrative field of health system cannot operate in these conditions when economic resources cannot solve the crisis in all the country. But we are no one to talk about this. And for this reason, someone in the health field can answer this.
Hi everybody! One of the big problems in Colombia is medical crisis. Health system in Colombia is governed by Law 100 and in the year 1993. That was good because it improved the coverage and access to health system. But at present, many E.P.S don't have resources, medicinals, and their employees haven't been paid. Why is this happening? Well, there are many reasons. One of them is government stalls the E.P.S money through a process. The real process must be like this.
First of all, people pay for their health. Then the money goes to the government, and immediately government receives the money, they must give the money to E.P.S.
But unfortunately, in real life the process is different. The process is...
First of all, people pay for their health. Government receives the money, and they don't give the money. They just stall it, and 3 or 4 months later, they give the money.
For that reason, many E.P.S have debts and their increases. Likewise, when E.P.S receive their money, they must pay their salaries, their public services, and other expenses. So they cannot pay a lot for medicines and for some resources, for example, crutches, wheelchairs, and orthopedic color. Yes, so all the problem in health system of Colombia are hospital in rural zone. People who live in rural zone are affected because in that place there isn't or there aren't hospital with specialist doctors. Just there is an urgency hospital with general doctors. So a person needs to travel around 3 or 4 hours to any city to receive an attention to any specialist. That's worrying because can you imagine a person who has cancer and that person every day needs to travel around 3 or 4 hours just to receive a treatment? That's horrible. Okay, anyway, I think the last problem is prescribed medicine. There are people which have serious illness and some general doctors always prescribe the same medicine, as you know, acetaminophen, ibuprofen, and sometimes loratadine. So this, as a consequence, brings, in worst case, dead people. Yes, that's horrible as well. Okay, we continue with Manolo. Thanks a lot.
What is the medical negligence? It is the lack of care or application to the protocols and methods previously established by the health authorities and the scientific community. Now we have the steps for appear a claim. The first step is appear a claim to the hospital, because when you are sure that there has been a medical negligence, he directs a writing to the hospital and the doctor who committed it.
Now we have some steps to appear a claim. At first, we have asked for a legal consultation, hearing the right professional, agreeing professional fees, celebrate professional service contract with the lawyer, empowering the lawyer, indicate the facts, agreeing in details direct to the attorney, provide medical records for evaluation of a professional, realizes psychological and psychiatric assessment in the event of moral damages exist. Estimate the damages including consequential damages and lost product fees. Determining the money foregone in the event of having a business or cessation of an activity or employment as a result of bodily injury or psychological effects. The assessment must be performed by a certified public accountant, for which the injured party must be provided documents showing income, type of activity. Submit the application for conciliation direct to a mediation center, paying the fees of the conciliator. Pay fees fixed by the center with conciliation. Celebration of the settlement hearing, discussion and appreciation among lawyers of the parties to the possibles of reaching a settlement. If there is an intention to reach a settlement, it can suspend to hearing for discussion of economic issues. In the event of reaching a final settlement, should celebrate the conciliation settlement in which records the facts, the commitment established, the date of payment, legal or natural person obligated to pay, the person to whom he will pay, the payment and the payment date. The conciliation must contain the elements of a collection executive title. It must be clear, explicit, and enforceable. The conciliation thus res judicata, which means that in the event of default may be charged executor.
Have you been in this situation? What do you think about the nowadays health system? Well, according to the first question, the nowadays national health state, we can say that it's broken and wrong. In a national level, the system is in crisis in all three sectors. Users, workers, and governmental public administrators that finally who are paying for the damage are the users, because they denied services, denied situations for the lack of resources or money orders in E.P.S in public hospitals. And sometimes in private hospitals they start to stop services, so it is the same in the public and private sector of health. The public sector is starting closing hospitals in towns people don't have a place to be attended. Health sector employees are in the same situation, and the remuneration of the health sector is super low in contrast with other fields. There are multiple variables that enter in the game. The nowadays health sector feels increases, and the different factors that are acting are the users, workers, and governmental public administrators are being ignored, and the crisis is going to explode. Every day is more difficult. What is the reason of medical negligence? Medical negligence. The thing is that the indication of a problem is in the health professional when the system is inoperative, yes? A professional can authorize a service, request a medicine, but the E.P.S or the person in charge can decline that petition, yes? And the user interpret with medical negligence that the doctor don't want to do anything, and if we talk about negligence, it's not the same. And I believe that nobody in the fields at indulge for a user, in this case a patient. The idea of a doctor is always helps people, user, patient, and that's why they started it. Have you been in this situation? Personally, no. Fortunately, my relatives know library journeys. I hope that never happened to me.